Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan. Here is what I bring to you all from the world of medicine. New nasal vaccine strategy could improve COVID-19 protection. Currently, we all know that many vaccines against SARS-CoV-2 have substantially been found to reduce their mortality and also the severe progression of the disease. But protection against the infection is less effective. Vaccinated individuals are still catching COVID-19 and can eventually even spread the infection. So breakthrough infections are still occurring. Researchers from the Centenary Institute and the University of Sydney have developed a new nasal vaccination strategy that induces potent lung immunity and protection against the SARS-CoV-2 coronavirus. Flu shots can protect patients with heart failure from death. The flu has been long associated with an increased risk of life-threatening cardiovascular events, and even people with heart failure are already highly vulnerable to poor health outcomes. So an international study led by the McMaster University researchers and published in the Lancet Global Health has found that influenza vaccines greatly reduce both pneumonia as well as cardiovascular complications, specifically in people with heart failure. The study is the first clinical trial of the flu vaccine's effectiveness in patients with heart failure, and it also showed that over the entire year, the influenza vaccine reduced pneumonia by 40% and hospitalization reduced by 15% in patients with heart failure. During influenza season in the fall and the winter specifically, the influenza vaccine reduced the deaths by 20% in these patients. Keeping indoor humidity levels at a sweet spot may reduce the spread of COVID-19 further. The term relative humidity is the amount of moisture in the air as compared to the total moisture in the air that can actually hold at a given temperature before saturating and even forming condensation. So in a study appearing in the Journal of the Royal Society Interface, it reports that maintaining an indoor relative humidity between 40 and 60% is associated with a relatively lower rates of COVID-19 infection and deaths, while indoor conditions outside this range are associated with worse COVID-19 outcomes. So to put this into perspective, most people are comfortable between the 30 and 50% relative humidity range, and an airplane cabin is at around 20% relative humidity. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.